Hi everyone. Why are some Asian immigrants in the US at high risk for chronic diseases? What if I told you that moving to the United States could change your risk of developing diabetes and heart diseases, even if you do not look overweight? Researchers have shown that some Asian immigrant population in the US, especially South Asians, face a surprisingly high risk of chronic diseases. One major US study found that about 23% of South Asian adults had diabetes, compared with approximately 6% of white adults. That's a huge difference. And here is something really important. BMI does not always tell you the whole story. Asian population can develop more visceral fat. That is the fat stored around your internal organs even when their BMI appears to be in the normal range, and this can increase the risk of type 2 diabetes, high blood pressure, abnormal cholesterol, and heart diseases. But diabetes is not the only concern. Asian immigrants living in the United States may also face risk related to hypertension, metabolic syndrome, fatty liver disease, cardiovascular diseases, and chronic kidney disease. So, why might this happen? Researchers pointed out that several possible factors change in traditional diet, more processed foods, less physical activity, weight gain after immigration, the most importantly, stress, and the challenges of adapting to American culture. Researchers also suggest that for some Asian immigrant groups, the longer they live in the United States, the greater their risk of diabetes may become possible. But remember, Asian Americans are not one single group. Risk can be different among Asian Indians, Chinese, Sri Lankans, Filipinos, Vietnamese, Koreans, Japanese, and other Asian population. So, what is the takeaway? If you are an Asian immigrant living in the United States, do not judge your health by your weight or BMI. Talk to your healthcare provider about your blood sugar, blood pressure, cholesterol, and other metabolic risk factors. Because sometimes the biggest health risks are not the one you can see on the outside. Know your numbers, know your risk, and take action early. Stay healthy, stay smart, and stay focused with NutriFocus. This is RD Prasad.